I've often heard people say that kidney stones are as painful as delivering a baby. And my wife and I would often debate whether this was true or not, so we decided, let's duke it out. She got pregnant and I got a kidney stone. Actually, two to be precise. But I soon realized I had made a terrible mistake in this challenge. And it wasn't that my wife was right, which, for the record, she always is. But these kidney stones cost me 4 ultrasounds, 3 CAT scans, and a surgical procedure. Yeah, ouch. But then as I looked at the bill, something struck me. I had paid over $1,000 for a CAT scan and over $250 for an ultrasound. And this was despite having a health plan that cost over $2,200 a month. So you can see that the pain from these bills started to be a lot more painful than the actual stone. And speaking of stone, I did not intentionally cause my stones to occur. If that were the case, we'd be having a very different kind of conversation today. So here's a real shocker. I am part of less than 1% of doctors throughout the country that practices a unique form of primary care, where I help my patients get CAT scans for $350 and ultrasounds for $150, whether or not they have health insurance, and without any paperwork hassle. So something literally doesn't add up, but the cost of procedures isn't the only issue with our medical system today. There is so much administrative burden and bureaucracy that sucks away a ton of time and money. 25% of healthcare spending in our country, which can be up to $900 billion, is considered to be waste in our system. You know, in the traditional system, when you get sick, you go to your doctor if you're lucky, or the nearby Doc in the Box, and you're immediately greeted with a stack of papers, which pretty much could be your autobiography. Questions about your anxiety, questions about whether you have enough food on the table, questions about your history. So why are you asked all these questions about poverty, work stress, family life? Well, it turns out that only 11% of our health is determined by the medical care we get. And yet, as a country, we spend over $3.2 trillion on healthcare, most of which is not going to the people working in it. So what are these other factors? Well, the biggest is individual behavior, followed by social circumstances, genetics and biology, and your environment. So it begins to make sense why we want to get to know about you as a person, why we want to know whether you have enough food on the table, or whether your job is so stressful that you may want to leave it. Perhaps it might influence which medication you're likely to take, or which test you may push off, or not. So while these questions have a great purpose in theory to determine your whole person health, they've unfortunately become deeply embedded in a financial model, one where if the box is not checked, it doesn't count. And if it doesn't count, it doesn't generate money. So back to your office visit. You complete your stack of papers and you begin the waiting game. You wait, you wait, and you wait. And you're finally seen only to spend a few minutes with your doctor. Studies show that the average amount of in-person face time patients spend with their doctors is between 8 to 12 minutes. And yet sometimes they spend over 2 hours between traveling and sitting in waiting rooms for those precious 8 minutes. So in these 8 minutes, you were told you have strep throat, you needed antibiotics, and you had to go to the pharmacy. And by the way, you're carrying some excess weight, so you need to lose weight, eat healthier, exercise more, the end. And this cost you $120. So let's put all this together, right? So health is determined by so much more than medical care itself. The biggest is individual behavior. You're asked a lot of questions, which are important, but you only have 8 minutes with your doctor. So you get through the current issue at hand. In the long term, perhaps more important things, such as addressing your lifestyle challenges or your eating or exercise, is pushed aside because there isn't enough time because your doctor has to see 22 other patients that day. And this cost you over $100. Now, many of you can probably relate to the scenario I just described. What if I told you that there are over 1,000 doctors across the country that could have probably given you that visit for less than $10 if you're a member of their practice, and that they could spend an hour face-to-face with you exploring your challenges with your health, and that whether you had health insurance or not, you could choose to have that type of care. Health insurance is a way of paying for care. It does not necessarily give you access to good care. Now think about every other way you use insurance. Car insurance you use for a car accident, not to replace your wipers or rotate your tires or for an oil change. Homeowners insurance you use if a tree falls on your house, not to retar your driveway or clean your gutters or repair a faucet. So why do we use health insurance for things other than catastrophic events, for, say, primary care, which is often the lowest cost service in healthcare? In a model known across the country as direct primary care, or DPC for short, doctors like myself operate outside of the insurance world to give you care that is accessible, doesn't break the bank, and doesn't discriminate based on health insurance. Here's how it works. Think Amazon Prime or gym membership, but to your doctor's office. For a low monthly membership subscription fee, which often costs less than a cup of coffee a day, you get an all-access pass directly to your doctor. It includes things like in-person visits, telehealth, email, texting, phone calls, all without any copays. It also includes tests like EKGs or breathing tests at no additional cost. Doctors get to provide excellent care coordination by directly working with other doctors that take care of you and bypassing the layers and complexities of our healthcare system. And there's more. Doctors may offer lower cost labs at up to 90% lower the cost, lower cost imaging, such as CAT scans and ultrasounds, and lower cost medications oftentimes dispensed right in the office. And there's more. Depending on the type of practice, the doctor may offer acupuncture or integrative medicine. By taking down these artificial barriers that increase the cost of care, doctors get to not only give you great care, but help you save money. So let's see how DPC worked for John. John is in his 60s and he has a form of blood cancer that's chronic, but still weakens his immune system. He does a lot of work with plants, and he noticed one day that his finger was swollen. So what did he do? He sent me a text message. 13 text messages and 4 pictures later, we determined that, we needed a video visit so I can get some more information. 5 hours later, that same day, John and I had a video visit, which lasted about 10 minutes because I knew him pretty well. Toward the end of the visit, we decided, I really needed to see this in person and that he'd come in the next day. So John came in the next morning. He didn't wait, which was reassuring because it minimized any exposure for him. He came right in, I examined his fingers, and we decided he needed antibiotics. And then something really funny happened. John's wife, who was also a patient of mine and had been struggling to really understand the direct primary care model of care, texted him a question. "Can you get the antibiotics from the doctor?" she asked. Now, I can't tell you how excited that made me feel. I was like, yes, she gets it. So John walked away that day, antibiotics in hand, that cost him $3. Over the next 3 days and through the weekend, John and I exchanged 19 text messages and 3 picture messages until his infection had resolved. And this entire experience cost him $3. The strange thing about direct primary care is that those of us who do it are incentivized to work for you. Let's think about that for a second. Who does your doctor work for? You? Their employer? Or in some way, the insurance company that ultimately gives the money that pays their salary? What if your doctor was not incentivized to refer within their organization? Or that they didn't have to worry about the number of patients they saw per day, and that you truly felt like you had a partner who had your best interest in mind with minimal conflicting factors? The answer is not hypothetical. It's the reality at over 1,300 practices across the country. So now you're asking yourself, why doesn't everyone do direct primary care? Well, some argue that if every doctor that normally takes care of 2,000 to 3,000 patients suddenly went into direct primary care, where we take care of 300 to 500 patients, that the primary care shortage in our country would get worse. The reality for us docs is that the job of a primary care physician is so underappreciated and overburdened that many dread going into it. Perhaps by changing the model, we'll get more docs and more access. And I'll be honest, as a direct primary care doctor, I have to do a lot more than medicine. I have to coach, I have to care coordinate, I have to keep accounting, I have to negotiate test prices for my patients, I have to network. And it may not be for everyone. But as a patient, direct primary care clearly has its benefits. Studies have shown that employers can save up to 40% on healthcare costs by offering direct primary care. They've also shown a decrease in cost from demand for healthcare services, a 41% reduction in emergency room usage, and a 20% reduction in hospitalizations, all while having savings with medications and labs that are provided at lower cost. The satisfaction rate remains high because the service provider, the doctor, is focused on the client, the patient. But let's remember that direct primary care is a piece of the puzzle, the primary care piece of it, which really should be your gateway to your healthcare experience. It doesn't replace the need for care outside the scope of primary care for, say, hospitalizations due to heart attacks or other life-threatening events, or labor and delivery, or complex conditions that really need to be co-managed with a specialist. But when you need to use other parts of the healthcare system, your direct primary care doc is right there by your side, helping to make that experience as smooth as possible. And while I said that primary care is a piece of the puzzle, it's probably the most important piece, where 80 to 90% of your healthcare needs can be met by your direct primary care doctor at a fraction of the cost, with much less waiting time, much more time with your doctor, and a far more personalized experience. Now let's be clear. I am not blaming the doctors in the traditional system, but I am questioning the system as a whole. I'm questioning the system that doesn't educate us patients and doctors about the choices that we have. I'm questioning a system that is building artificial barriers so that doctors and patients can't have relationships. I'm questioning the system that is wasting billions of dollars of your hard-earned money on things like billing, coding, and checking boxes. And I'm questioning the system that isn't solving the fact that in 8 minutes, we cannot help you work on the most important determinants of your health. But there are choices out there. Direct primary care is one of them. It may not be for everyone. For my patient, John, it made a difference. If you didn't know it existed, well, now you do. And I hope that as you look at your health, you remind yourself that you have far more choices and decisions you can make. Thank you.